Asthma. Asthma. For Chinese illness name, asthma is 哮喘. 哮喘. 喘 is wizard. 哮 is wizard. 喘 is like a difficult person. Difficult person. Severe kind of difficult person. So they usually together 哮 and 喘 with the sound. So what is asthma? What is asthma? So asthma still belongs to lung system disorder. Still pretty commonly for the children. And typically symptoms is wheezing, cough, difficult breathing, happens same time. And then after treatment, they could be stopped, look like a normal person, and then recurrent happen again. So in Chinese medicine, we call that belong 哮喘. 哮 is wheezing. It's some sound in the throat area. 喘 is short breath, difficult breathing. But they may happen same time. Difficult breathing will have some special kind of wheezer sounds in there. So that's basically blocking the air passing the way when we have some wheezers and short breathing. And also some generate some phlegm in the throat area. So that's basically happens when asthma. Also happens in adults. So asthma is a very severe kind of disorder. So when asthma attacking, truly causes severe kind of like people, pretty severe kind of difficult breathing. That we talked about short breath, short breath. And some people say, "Oh, I look like I will be dead. I will be dead." So that's asthma attack is very emergency kind of situation. For the etiology, for the etiology. So that's basically external reason and internal reasons kind of combination. Internally, it's a difference in there, especially for kids. We say their organ not totally developed. Their lung is weaker, deficiency. Their spleen is weaker, deficiency. And the kidney is weaker, deficiency. So that's some result, some phlegm retention inside the body, and then blocking the airway passing the root. And mostly the combination with external reasons, same time. External pathogen, like touching with some wind or cold, or even some smell, or even sometimes eating something, can trigger it. Yeah, can trigger it. So that's basically there are lots of trigger reasons by external pathogens. So clinical diagnosis for people got asthma. So usually patient have histories like about like kind of eczema or kind of allergy, kind of rhinitis. So basically have histories relationship with allergy. So that's allergy kind of irritant eczema, allergy kind of illness. Or maybe patient have family history, like their parents have asthma, but they may have like symptoms right now, or may don't have symptoms right now, but just have family history. Or maybe brothers, sisters have like asthma. And then they have repeated happens, kind of attacking, attacking, asthma attacking. So like the weather changing, or maybe eating something special, some allergy kind of food or whatever. So that can trigger it. So repeatedly happens and something can trigger it. It usually often happens suddenly outside. So that's the usually asthma attacking. It suddenly happens with some trigger reasons. And but usually they have some other symptoms, like generally say pretty easily sneezing and maybe cough and maybe some pressure in the chest area. But the patient can suddenly got attacking, got pretty difficult breathing. So that's basically when it happens, then feel tightness in the chest, short breath, and wheezing, and the symptoms most severe. So asthma we separate with two stages. One stage is attacking stage. We say in that stage, kind of emergency kind of situation. And when the emergency situation relieves, but the patient may still have some symptoms. So that stage, we call it remission stage. So we separated to talking about for this stage, these two stages. So we're talking about attacking stage. Attacking stage, patient may have cold asthma, like the pattern here, cold asthma. So cold asthma, the symptoms. So beside cough, wheezing, and certainly short breath, difficult breathing, and they may have phlegm is clear and thin. And their body is cold. Body cold, limbs is cold. Discharge is clear. Face is pale. Aversion to cold. No sweat. So cold part. So tongue slightly red, that's for normal tongue. For normal tongue. So basically, now to changing for the tongue. And the white sleepy coating because cold inside. Kind of water retention there. And the pulse floating slippery. So basically, asthma attacking is external reason combination with internal reason together. So cold attacking mainly is kind of external reason with floating pulse here. And the finger vein are red. So finger vein red means cold, pupil means heat. So don't confuse it here. Little bit difference with usually we talking about the tongue. So that's the cold asthma. Then we treatment principle. We need warming the lung and dispersing cold, and the result phlegm, and the relieve like a short breath. So pay attention. Attacking stage, emergency kind of situation. If the case never have asthma before, just the first time attacking, sending to emergency. Sending to emergency. Try not just treat with acupuncture. But if patient have history for asthma attacking, like got a clear diagnosis already, and have medication like inhaler in hand already, give the medication same time, not only use like needles or acupuncture. So that's pretty emergency kind of situations. But we can use acupuncture treat the same time, or acupressure treat the same time. So 定喘, stop cough, relieve asthma. That's pretty working point. And Ren 22, yeah, Ren 22. Ren 22, we need to pretty be careful. Yeah, right in the over the trachea area. And needle not too deep. And also don't leave the needle there. Yeah, you can put the needle there and then withdraw the needles. So leaving the needle there, if patients, especially for kids, always moving, maybe cause other damage in there. So still dangerous point for kids. And the part cutting 6, open the chest. Yeah. And the bladder 12. Yeah, bladder 12 for like wind point. Yeah, wind point relieve external. Certainly you still can use gallbladder 20 to relieve some external pathogen. But we just try like each time don't use too many needles. And also for the baby, yeah, also for the case. You can needle it or acupuncture it with the pads holding the baby. So in this way, and especially we are not like retain the needles or keep the needles for a long term. So basically just holding the baby there and put the needle in and then withdraw it. So Ren 22, just tap in. Basically, For adults, we're talking about 0.3 to 0.5 millimeter. For the case, even more shallow. And depending how older of the case, I will suggest you 0.1 to 0.3. Like a more young case, more shallow. A little bigger, you can go to a little bit deeper. Or maybe you just acupuncture. So that's for 人22. So that's for this part. Yeah, this part. Next pattern we talked about heat asthma. Heat pattern. So still symptoms, cough with withering, and then maybe make more sounds with short breath. And phlegm in the south area. So phlegm coming out is yellow and sticky. And chest pressure. And fever with red face, dry mouth, red south area, and yellow urination and constipation. Tongue is red, yellow coating. So that's heat sense here. And with some 3P rapid pulse. So heat and phlegm. If we're looking for the fingers, pupil colors. So treatment pencil for this one, clear heat, mainly from the lung, without phlegm, and relieve cough, stop asthma. So generally say, we use pretty similar points with lots of others. But truly we can add in some points to clear heat, like 214 or Li11. So that clears some internal heat. Or maybe even you can use lung 5, clear lung heat. And some points result flat. So some for 40 result flat. So that's for heat pattern. Yeah, heat pattern. Then we may have some more combination pattern. External heat, cold. Yeah, external cold and internal heat. So that's mixed external pattern and internal pattern. So usually patient got external cold first, and then moving to internally, blocking their cause internal heat. But maybe external cold still not relieved yet. So that's the pattern for this one. So generally still withers, short breath, cough, and nose discharging with clear discharging, nothing there. So this part plus fever with aversion to cold, this part belong to external cold. and sticky yellow phlegm, and even thirsty, dry stool, yellow urination. These parts belong to internal heat. So tongue is right. It's depending. It's depending. It's mostly external reason tongue coating may be not changing. But if internal heat severe, may be changing to yellow tongue coating. Because that's a combination pattern here. And the pulse, rapid pulse, maybe with rapid pulse together. That's still mainly internal heat. Yeah, internal heat situation. If mainly situation is external cold, the pulse will be floating under time. So still depending. So complication pattern is depending the situation. So that's the combination external cold and internal heat pattern. So our treatment principle just follow our pattern. Relieve external cold and clear internal heat and relieve cough asthma. So the points, so that's treat, relieve cough asthma and open the chest, bladder 12 is the midpoint. 出来有 still can adding clear heat points like do 14, LI 11. That's clear heat. Yeah, that's clear heat. So depending the situations, depending the situations. So talking stage, we still have some pattern. Non-excessive with kidney deficiency. So we say case the organs mostly is weaker, but something blocking the lung can cause excessive condition in the lung. So symptoms and signs for this one. So usually it's kind of a prolonged time courses. And then still attacking have a kind of a suddenly onset conditions, whether difficult breathing, chest blocking, continually in there. And the worst by the movement. So that's underlying deficiency there. Pale face and feel cold. Cold that's generally reflection for yang deficiency. Or we can say yang qi deficiency together. That's also called the poor appetite, clear kind urination. That's the deficiency part, mainly kidney deficiency part. And then cough, and then cough. Excessive, lung excessive. Oh no, excessive. So this is the lung excessive means the some phlegm in the lung. Yeah, some phlegm in the lung. So that's the excessive part is the passenger. So that still can belong to kind of excessive with difference there. That's your question there?
Jean,
Yeah,
because it says worsen with movement, that was what I was asking. Does it mean that this is exercise-induced asthma?
yeah, yeah. Exercises. It's for children. It's not truly like
Right, right.
just movement there.
Okay, thank you.
Yeah, you're welcome. Yeah, yeah. For children, it's not like people do some exercises. Yes, yeah. So that's why we say with the movement. Yeah, same meaning. Yeah, same meaning. So that's basically deficiency type. Yeah, with the movement getting worse. Yeah, getting worse. And cough and the big amount of phlegm. Even you can hear the sounds in the throat. And the pale tongue is different kind of tongue. Greasy tongue coating, that's phlegm kind of tongue. Pulse threaded, weaker, that's different. So generally speaking, that's the pattern. For long-term deficiency, here we're mainly talking about kidney deficiency because for kids problems, especially with under 6 years old, mainly problems relationship with kidney, genetic kind of deficiency. And the excessive part is some phlegm in the lung. So treatment principle for this one. So purging the lung result phlegm and tonified kidney. So we treat the branch and the root same time. So branch part, we still use the same points here. The root part, we go to some tonified points here. Also, you can add in like I like stomach 36 so much. So tonified, yeah, so tonified. Even not especially go to kidney, but generally say kids have problems. They also have T blood deficiency, spleen deficiency. So the points I like to say, not all the points with reducing. Reducing part for the lung. Yeah, reducing part for the lung. The other points you still need to tonify. Yeah, back to points still need tonify. Stomach 36 still need tonify. So reducing case for excessive part. Deficiency part still need to tonify. Then we go to remission stage. So that means during attacking stage, like after treatment, patient cannot relieve, and maybe they have another attacking again. So that's basically between attacking and attacking stage. That's or we talking about the remission stage. Remission stage basically patient will have some mainly deficiency in there. So that's we talking about lung and spleen T deficiency. Lung and spleen T deficiency. So this pattern mainly qi deficiency. So pale face, still have short breath and spontaneous sweating, and still cough, but generally weaker kind of cough, and generally fatigue, and don't want to speak. That's qi deficiency. Generally body constitution is weaker, and poor appetite losing stool, mainly relationship with spleen deficiency, and pretty easily catching cold, 狼气 deficiency, 胃气 deficiency, pale tongue with white coating, thin and little pulse. So that's generally qi deficiency in there. So we mainly tonify qi, mainly tonify 狼气, tonify spleen qi, and consolidate the external, means tonify wei qi, protecting attacking passenger from external, protecting superficial of the body. So that's we say during attacking stage, mainly we stop cough, relieve asthma. But during the remission stage, we mainly need tonify. So all the points with tonify technique, and we can use massage. Yeah, back through of the lung. You also can go to back through of the spleen. Bladder 43 is pretty stronger 25 points. Generally 25 for the organs and 25 qi and blood. Pretty similar like the stomach 36. Pretty good 25 points. And can use massage anytime. So that's for generally qi deficiency. Then we're talking about the pattern yang deficiency. Yang deficiency relationship with the organs, spleen and kidney. So patient possible have both deficiency because for kids their organ is weaker. Possible one organ deficiency more severe compared with the others. So we still see clinical symptoms and signs, but we just putting here together. So pale face, cold body and cold lips, that's yang deficiency. And wheezing and cough, short breath, and possible have palpitations because yang deficiency, cold fluid may rising up go to upper jaw. And abdominal distension, poor appetite, that more go to 3 yang deficiency. And diarrhea losing stool can come from both. The tongue, pale tongue, white tongue coating, pulse still serrated and weak. So that's the part we talking about mainly yang deficiency. Treatment principle, warming kidney and spleen yang, codified spleen, warming kidney yang, and consolidate for the lung and improve T receptions because patient have difficult breathing and it's not truly during attacking stage. But generally, we still talk about tonify, mainly tonify. So mainly tonify, we go to back through of the kidney and the back through of the qi. Yeah. 气海疏 the missing one 疏 here. Yeah. 气海 is 人 6. Bladder 24 is 气海疏 气海疏阿金疏 there. Yeah. 气海疏 Certainly, you still can go to back through of the spleen. Nothing wrong. And the kidney 3 yuan south of the kidney, yeah, kidney 25. And you still can go to spleen yuan south point, the 25. Even stomach 36, still good. All the points with 25 technique. And the maxa is good for deficiency kind of condition. So that's for young deficiency. Then we're talking about indifferency pattern. Indifferency pattern mainly relationship with lung yin and kidney indifferency. So indifferency will have differency healing there. So differency healing there make the face is red color, especially with the cheekbone area and the neck sweat. 5 center heat. And the emaciation. That's basically some indifferency patients pretty easily. Short breath. When they cough, they got dry cough. And night urination. That's still indifferency symptom. Tongue right, filled, no coating, or maybe partly no coating. Thus, we also use the geographic kind of tongue. If just partly no coating there. Pulse rapid and rapid. So that's indifferency pattern. Indifferency, we need nursing and clear heat. Yeah, difference heat. We still can clear it. And tonify the lung or nourishing the lung, nourishing the kidney. So back to points, go to the lung and the kidney. Yuan south points of the lung, of the kidney, and the water points of the lung. So that's basically, yeah. Water points of the lung, truly we can clear heat from the lung. Certainly, you may have more points. Points with tonify technique and maxa. We say deficiency kind of patient, indifferency. We need to see. Yeah. Maxa good for deficiency, but we say maxa not used for heat. So how about the deficiency heat inside the body? So if patient more severe kind of deficiency, less heat, we still can use maxa. But if patient severe kind of heat may be not good for massage. Even your massage, you try to make a short term and mainly go to lower part of the body, like a lower limb. I'm still talking about the kidney one. Kidney one is good point for massage, especially for kidney insufficiency kind of situation. It's pretty good for massage. Then we're talking about prevention. So we try to avoid any kind of allergies. Don't touching any kind of allergies. And treat originally problems. So that's the mainly prevention way. So also including smoking can trigger and some painting can trigger, some dust can trigger, pollution can trigger, pollen can trigger, and seafood, yes, seafood truly can trigger allergy kind of situation. So that's what TCM. If patient have allergy kind of problem, we tell patient don't eating seafood, and the cold can trigger. Cold. And we also say try to preventing some overactivity or some emotions. That's also possible can trigger asthma attacking. And then we're talking about regular physical activity. Some physical exercises make the body strong. And also tell the patient itself how to control. Generally, like what's the way is good for preventing and control the problem. So that's generally we're talking about preventing. And for nurse care, keep the living environment is clear and warm. Yeah. And ventilating, keep the room, temperature is standard temperature there. And try not attack, contacting with allergy agents. And also keep the food, easy digestion and more nutrition. Try not eating raw food, cold food, greasy food, or spicy food. So nothing special too strong, even including sweating and soft food. And try away from seafood, especially when allergy attacking. And also pay attention for the children mental state and enough nutrition. And pay attention to the children. If anything changing for the breathing rate, heart rate, and pulse, maybe it's asthma, will be attacking. So be careful, be careful. And put some medication in hand. If it's attacking, just immediately got the treatment.